We'd like to welcome you to the special presentation of Medical Marijuana for Seniors with Dr. Mintz, brought to you by the following partnership.
Discussion today is produced in partnership with SmithLife Homecare, and they are a very important positive aging community champion that has been with us for many years. And Kathleen, I am so charged up that you all got Dr. Mintz for this discussion today, and that you're going to be hosting this event for us. Let's get to know you and SmithLife Homecare a little bit better, and then we'll kick things off with Dr. Mintz.
Well, thank you, Steve. Really appreciate the opportunity to be on here with you today, especially live and interactive, which is a first for SmithLife Homecare. So SmithLife Homecare is a home care agency that's serving Montgomery County and Washington, D.C. It is an award-winning company that has recently been awarded Best in Home Care by the readers of Jewish Weekly. And they've been serving this area for 20 plus years. So I am personally phasing out as the Director of Community Relations, and I'm starting a new role as a commissioner on the Commission on Aging, which is a 3-year term to give back to the community that's been so great to us. We have significantly grown this company over the last 5.5 years, thanks to Renan Augusto, who is in the background here. So just want to say thanks to an amazing team for all that we've accomplished over the last 5.5 years. And the next round of talent will take it forward.
I love it. And congratulations on your graduation to
another chapter.
Another chapter, exactly. We don't like to use the word retirement on here, and everything that you all have accomplished. And I dropped the link to the SmithLife Homecare website in chat. Well, folks, I'm going to duck behind the curtain here, and Kathleen is going to be hosting the interview with Dr. Mintz. But I want to remind you all, if you've got questions, comments, suggestions, ideas, just use chat, Q&A, or when we open things up for discussion, you can raise your little virtual hand. I'm going to drop behind the curtain and really looking forward to this interview, Kathleen.
Great. I am too. We are all excited about this interview with Dr. Matthew Mintz, who I've known professionally in the community for several years. He's making great strides in educating the general public on some exciting options for medical marijuana for seniors. So a quick bio about Dr. Mintz. First of all, he's a fellow with the American College of Physicians. He's also elected as faculty for Alpha Omega Alpha in 2007. He received the Distinguished Teacher Award from the GW School of Medicine in 2004. He's also received the Sol Katz Teaching Award from the American College of Physicians, the DC chapter. And he is consistently recognized in the Washingtonian magazine Top Doctors for many, many years. And we're honored to have you here today, Dr. Mintz. So thank you for making time for us and the audience today.
Thank you for having me. It's great to be here.
Thanks. So to get to the program, I'm going to ask you 4 questions. And then I believe we'll take kind of more general Q&A after that. So my first question is, what is medical marijuana and how is that different from regular marijuana?
Right. So that's a good question. So marijuana is a plant. Plant's been around for millennium, millions and about 60 million years plus or minus. And it's been around for a while, and it has medicinal properties to it. So it also has recreational properties to it. So people have been using plants, including marijuana, as a medicine for thousands of years, and they've been using recreational marijuana for thousands of years. And so obviously people know what a medicine is, right? So you take a medicine to make you feel better. Recreational is using it as a substance. So people use alcohol recreationally. They might have a little drink with dinner, and then some people, they drink a little bit too much and get drunk, and that's what recreational use of alcohol is. I mean, alcohol does have some medicinal properties too. So that's what we mean by recreational use. So both marijuana, it can be used recreationally, and it can be used medicinally. From a legal standpoint, marijuana in the United States is federally illegal. Unlike alcohol, which is legal, you can go to a store and purchase it if you're 21 or older. We have commercials on the Super Bowl for it. So marijuana is not legal federally across the country, but state by state, they've made different decisions. And so in some states, like Texas, for example, it is neither legal recreationally or medicinally. In some states, it's only legal medicinally for medicinal purposes. And some states, it's legal for recreational purposes. In some states, it's legal both. DC, Maryland, and Virginia, it is actually legally both recreationally and medicinally. In Maryland, the elections last year, they just voted to legalize recreational marijuana. And so that was actually officially legal in January, but the dispensaries didn't really open for recreational marijuana and until July. So it's just recently become available recreationally as opposed to medicinally. And I'll tell you a little bit later on how you qualify for medicinal and what the difference is between the two from a use and getting it standpoint. But that's what we mean by recreational versus medicinal. And I will add, though, that for recreational use, any adult can get it. You don't have to qualify or certify. And for medicinal, you have to qualify and certify and see a doctor. So I'll give you more details toward the end of that. But that's basically the difference. Well, what is it? It's a plant. And so it's a plant that can be used for both these things. It can be used medicinally or recreationally. So that's what we mean by medical versus recreational marijuana or cannabis.
Okay, question number 2. So how does medical marijuana work exactly?
Okay.
My only experience with marijuana was in my 20s, and that was recreational, illegally, but I'm sure I wasn't alone. So how does it work now?
Right. So basically, so marijuana is a plant. I like to use the term cannabis because that's the scientific name. And it has properties, the components of the plant have properties in it that have biological effects. And so there's a lot of different things in cannabis. And how it works in the body is we have receptors in our brain and throughout our body called cannabinoid receptors. Our bodies make their own cannabinoids. So there are substances mostly made by the brain and the nerve tissue that regulate a bunch of functions. It regulates sleep, pain, appetite, things like that. And the cannabis plant has plant substances that hit those receptors in the brain, in the body, to have different effects. And that's basically how it works. So there's lots of different substances in the plant. There's over hundreds of biologically active compounds in the plant. The two main ones that people know are THC and CBD. THC is the thing in cannabis that makes you high or sleepy. So that's how it's used recreationally, is primarily for the feeling of a high that you can get with cannabis. But THC does other things too. It's good for pain. It's good for anxiety. It's good for tremors. So THC does that. There's other cannabinoids though. Another big one is CBD. Now CBD it has some similar properties to THC and some different properties. So CBD will not make you high or sleepy. It has what's called psychoactive properties. So you're not going to be high or sleepy with CBD. CBD is also very good for anxiety. It's very good for inflammation. And so there are multiple cannabinoids within the plant. There's CBN, CBG, but the two main ones are THC and CBD. Now, one of the questions I often get is, well, what's the difference when I just see CBD? Like I could go to Mom's Organic Market and get some CBD oil. And so what that is there's another plant called hemp. And hemp is very similar to marijuana or cannabis, but the difference is it has very little THC. And it's also used for industrial purposes. So the Farm Bill in 2019 was passed legalizing hemp. So hemp-based CBD, completely legal. You can get it, you can get it online. You can get it at a gas station. You can get it at Mom's Organic Market. It's not really used recreationally. People use it more on the medicinal side. But unlike marijuana, which is regulated by the state level, hemp-based CBD is not regulated anywhere. It's not regulated by the FDA. It's not regulated by the state. So while it's much easier to get than marijuana, you have to be really, really careful about getting it because it's not regulated. Anyone can pour some vegetable oil in a bottle, stick a CBD label on it, and call it CBD. So you really need to be careful when you purchase, if you're going just with the CBD, that you're getting it from, a reputable person and you know exactly what's in it. I can take more questions about it if people are interested. So the other thing about marijuana is that there's more than just the cannabinoids. So not only is there THC and CBD and a couple other cannabinoids, there are other things in the plant that also have additional biological properties. One of the main ones are called terpenes. So terpenes are what gives plants and fruit their like smell or aroma. So one terpene, a common one, is limonene. So limonene is the thing that in oranges and lemons that make it smell like citrus. That's a terpene, and cannabis has that terpene. Well, limonene has medicinal properties. They are mood elevators. It's like a natural antidepressant. And so there are lots of different kind of terpenes within the plant that have different properties. And so you can pick specific strains of specific plants to have different effects. So if you need something that's uplifting, that's going to give you energy, you would use one kind of strain. If you need something to help you go to sleep and help with pain, you might use another kind of strain. And so that gives you a sense of how you take advantage of those different properties within different plants, and then we can use it medicinally. And it can be used for a variety of different things. It can be the three most common things I see patients with is pain, anxiety, and sleep. Those are the three most common things. And it can be very good for all of these things. And you would use it a little bit differently depending on the type of pain the patient has, and whether they have problems falling asleep, let's say, or staying asleep, or both. And I would give patients recommendations specifically for how to use the cannabis in that way. But that's basically how it works. It's a plant that has biologically active components that mimic what our own body makes and has effects on the body. And the main ones are cannabinoids. There's CBD and THC, and there's all these other components, including terpenes, and the combination of all of those things sort of give the plant their medicinal properties.
Wow. That's a lot of information. Very interesting. So question 3 is, so how can we use it safely?
Yeah, that's a really important question, because while it has a lot of safety properties, anything can be dangerous if you're not using it correctly. So there's a couple things to think about. One has to do with the addictive potential. One of the reasons why it's still federally legal is because the government at the time was concerned about addictive properties because it's used recreationally. Interestingly, though, cannabis is not very addictive. It is about as addictive as caffeine. So much less addictive than nicotine, much less addictive than alcohol, certainly way less addictive than narcotics. So that's an important thing. The other thing is that the lethal dose is astronomically high, and what I mean by that is that it can't kill you. Okay, so you can get very sleepy, you can get very high, you can have a lot of unpleasant effects if you're taking too much, but it's not going to kill you. And that's very, very different than, let's say, opioids. If you take one extra Percocet by accident, that can sometimes kill you. And that's why we have this opioid crisis in our society. Even alcohol, we don't think of alcohol as lethal, but you hear these stories about kids on college campus and they drank too much and it killed them. Alcohol can kill you. Doesn't usually, but it can. Cannabis can't kill you. So it's not very addictive, and it's from a standpoint of like, is it going to kill me? The answer is no. So it has a very good safety profile. But if you want to use it safely, you have to keep a couple things in mind. First of all, we don't want patients to smoke. Okay, smoking is not good for you. So I never recommend that patients smoke because smoking is not good for you. The good news is that there's lots of other ways to use cannabis. So I use topical cannabis. Topical cannabis is very good. There are creams and lotions you can use on like joints that hurt, for example. And what's great about topical cannabis is it's not absorbed in the bloodstream. So you won't, even if there's a lot of THC, you won't get sleepy or high. One of the things I like particularly for seniors is something called tinctures. So tinctures are where you take the leaf and you extract all the good stuff into an oil and you drop the oil, little drops under your tongue. It's absorbed by the blood. Your tongue has a lot of blood vessels. So it's absorbed by those blood vessels and can be very effective. And I really like it because you're only dosing drop by drop. So that's really nice. What's very popular are gummies or edibles. And so you can chew them and some they usually taste pretty good. One of the things I'm not crazy about edibles is they take a long time to work. So they take about an hour to kick in. They're good because they last a really long time, but sometimes it can be really hard to sort of dose it. So if you're trying it for the first time and someone gives you a very high dose edible, you might feel fine for an hour, and then all of a sudden an hour, it's not so we don't like so. But edibles have a really good place because even though they take a long time to kick in and it's hard to dose them, for people who, let's say, have problems staying asleep, they can fall asleep okay, but they need something to last a long time. Edibles are great. And then the other thing that you can do is you can use vapes. So inhalation cannabis is great because it works really quickly. And because it works so quickly, you can dose it very easily. You can basically take a puff and wait a minute and see how that works, and then take another puff until you feel the effects without getting sleepy or high. So inhaling cannabis is really good for that. However, smoke is bad. So what they do is there are these essentially vaporizers or vapes where you can get inhaled cannabis, but in a safe way. And so what they do, similar to the tinctures, they extract everything into an oil, but they take the concentrated oil and they put it in a cartridge that almost looks like an electronic cigarette, looks like a cigarette. And basically when you inhale it, it triggers a battery that heats up the oil. So you're basically inhaling vaporized plant oil. You're not smoking, so there's nothing bad for the lungs or the heart or anything like that. So one way to use it safely is to use something that's not smokable. And then the other thing is the way that you dose it. And essentially is you start at a low dose and you slowly go up or titrate the medication. You go up very, very slowly on any of the formulations to get the desired effect without getting the undesired effect of feeling high or woozy or anything like that. So for example, if someone is having pain and it's a severe pain, you could take a puff of a cannabis vape, wait a minute, and if you don't feel anything, take another puff, and you keep taking a small puff every couple minutes until you feel the pain go away without feeling sleepy or high. So that's how you can use cannabis in a safe and effective way, treating the medical condition without feeling sleepy or high, without having to smoke.
Would that mean, I'm going to ask you question number 4, right? But a little quick side question. Just so would that mean not driving as a
That's a really good question. So all right. So from a legal standpoint, it is illegal to drive with any cannabis, whether it's legal recreationally, legal medicinally. It is illegal to drive, just like it's illegal to drive with alcohol. You can't be sipping on a beer and drive down the street with alcohol, right? So it is technically illegal to do that. But the reality is it has to do more with impairment. So using alcohol as an example, if maybe I don't have alcohol in the car, if I go to dinner and I have a couple sips of wine, can I drive? Sure. If I have a half a glass of wine and it's an hour after dinner, can I drive? And the answer is it depends. If it's me, if I have a half a glass of wine and a big meal, then it's digested, I should be fine. But my mom, who's 79 and very, very petite woman, half a glass of wine is all she needs for the evening. So it depends. So it's about impairment. It's about how the cannabis affects you. So if you're not feeling sleepy and you're not feeling high, then you should be able to drive without impairment. So you just have to be careful. So again, from a legal standpoint, no, no one can legally drive with cannabis. But for someone who has lots of medical conditions and needs to use the cannabis throughout the day, but is worried that they can't do what they need to do, you just may have to adjust the dose. You may have to use lower amounts that help with your pain. We'll just say pain, help with the pain a little bit, but not so much that you feel impaired or sleepy or high so that you can't safely drive. And again, and as another parallel, narcotics are prescription drugs, okay? For narcotics are prescription drugs. There's no legal restriction on driving with narcotics. People drive on narcotics all the time. And again, it depends. If someone who doesn't use narcotics regularly, which is hopefully most of us, you probably should not take a Percocet and drive down the street. But for some people with chronic pain who are taking very high dose narcotics and they're used to it, if they take a half a Percocet, they may be okay. And Benadryl is over the counter. People use it for sleep. It makes you very sleepy. There are people who take Benadryl at night to go to sleep. They're still groggy in the morning. They probably shouldn't be driving. So from a legal standpoint, it's one thing, but it's really about impairment. Are you safe to drive? And you should know, based on some experience, how it affects your body, whether it's safe or not for you to drive. That's a great question.
Okay, good. Thank you. Just as a mother of millennials, I just want to be lecturing them correctly. Okay. Last but not least, until we get to we have a lot of questions in the chat here, is so how do I get medical marijuana?
Good. So that goes back to what we were first talking about the difference between recreational and medicinal cannabis. So recreational it sounds like it's easy, but it's really complicated because the laws are very different. So some states allow, like they won't arrest you for possession, but that's how but you can't sell it. So DC is a good example of that. So DC, recreational cannabis has been legal in DC for a very long time. So you can grow it yourself and you can use a certain amount, but you can't sell it. And so the market in DC for recreational cannabis is very suspicious. So because you don't know where that cannabis is coming from. For medicinal cannabis, it's a different process. So it's legal and medicinally legal in 38 states in the District of Columbia, and every state has a different process. But essentially, it's registering with the state and getting certified by a clinician. And so, registering with the state in Maryland, it's onestop.md.gov. So the same website you would go for your driver's license, your fishing license, that's where you would go to register. And you pay a fee, I think it's $50. And you'll be registering with the state to use medicinal cannabis. Once you do that, then you have to see a certifying provider. They're not all you can be in the state of Maryland, you can be a doctor, you can be a podiatrist, you can be a dentist, you can be a nurse practitioner, and certain doctors, not every doctor, because the doctor has to be registered with the state. So your primary care physician may recommend or have you consider medical cannabis, but if they're not registered with the state to certify patients, they can't do that. So once you get registered with the state, you get certified by a certifying physician, and that allows you to go into the dispensary to get medical cannabis. Now, one of the issues is that all that is a piece of paper that allows you to do that. Most of the certifying providers locally, with rare exception, all they do is they give you the piece of paper. They don't tell you exactly where to go and what to take and how to take it and how does it interact with your medicine. They're not obligated to do that. They're just certifying you. So that's one thing that I do differently is I tell patients where to go, what to take, how to take it, how to adjust the dose, etc. Now, when you go to the dispensary, there are people there called bud tenders that can give you some guidance. And some of them are very knowledgeable, but it's important to note that the bud tenders have no medical training and they're not licensed at all. I mean, there's no regulation, So for example, if I have a patient, that I diagnose with diabetes, I wouldn't just send them to CVS pharmacy and ask the pharmacist what medicines. I would tell them I would write a prescription. At least the pharmacist at CVS has a PhD in pharmacology, like they've gone to school to learn about this. There's no formalized sort of process for the folks at the dispensary. So I always recommend that patients who want to use this medicinally, especially seniors, see a certifying provider, number one, but two, make sure that provider can tell them exactly where to go and what to take and how to take them. Now, the other thing that's interesting about Maryland is while this will be changing, as I mentioned, recreational cannabis went sort of live in July. And currently, the place you can get recreational cannabis is the medical dispensaries. So now that's going to change. Starting in January, we'll probably see the first recreational dispensaries, But right now, there is no difference in Maryland between the medical and recreational dispensaries. They're all one and the same. The difference is if you're a medical patient, you have access to more products. You can take a higher dose. The higher dose is allowed for 30 days, and you don't have to pay taxes. But I like the way Maryland did the recreational market because the products are highly regulated in the medicinal market. You know exactly what's in it, what you're taking, what the terpenes are, whether there's any toxins or pesticides or anything like that. In DC, for example, you have no idea. So you have no idea whether the recreational cannabis is laced with something or has pesticides. You just don't know because it's not regulated. And we'll see how how that changes over time. But right now, anyone who's over 18 can go into a medical dispensary and get similar to what a medical patient would get. They just have a little bit of differences. So basically, if you're interested in medical cannabis, you need to register with the state, DC, Maryland, Virginia. You have to see a certifying provider. I certify for DC and Maryland. I don't certify for Virginia because I don't have a Virginia license. And then with that information and with that paperwork, you then go to the dispensary and purchase the product. So that's basically how you can get it.
Wow, this is fascinating. I didn't know all this information, so I'm very excited to learn it. One quick question before we go to the audience. So assuming this is medical marijuana, does insurance take care of any of it or no? All private pay?
It's all private pay, just like insurance doesn't cover supplements, vitamin D, and the stuff that you get, over the counter at CVS. They don't pay for your ibuprofen. They're not going to pay for this either. So it's not going to be reimbursable by insurance. They're not going to cover insurance. In addition to that, because it's still federally illegal, you can't use your credit card at the dispensary. So make sure you come with cash in hand. There's an ATM machine in every dispensary because most people don't have that. But they can't take check. They can't take credit card. You have to have cash. So that's the other thing about purchasing.
Wow. I didn't know that either. Certainly is a little bit complicated, but
Yes.
That's why they have medical professionals like you to help people navigate a alternative route to pain management, I guess.
Yes.
So that's our 4 questions, our 4 official questions. So now
you've got a ton of questions in chat, so I can start rattling those off.
Go ahead, Steve. Go ahead.
That'd be great.
Well, so this is kind of neat. Margie says, Dr. Mintz was my internal medicine doctor for years. I'd like him to address medical marijuana for sleep.
Very good. Well, great that you joined, Margie. I remember you quite well. So that's wonderful. Yeah. So for sleep, it basically, there's a couple things. So number one is I talked a little bit about the different terpenes and properties. And so one of the ways we divide up cannabis is into different strains. And there's sativa strains, which are more uplifting, and there are indica strains that are good for sleep. There are also hybrid strains and mixes. So for sleep, I would recommend an indica strain. And the other thing is, I mentioned that there are more cannabinoids than just CBD and THC. One of them is called CBN. And so CBN stands for cannabinol, and that's a really good sort of sleep cannabinoid. And so I like to use cannabis indica strains that have a little bit of CBN. And so then it becomes, well, how do we use the tinctures? Do we use the edibles? How do you do that? So the answer is it depends on whether you have problems falling asleep or staying asleep. If it's just falling asleep, like my mind is racing, I can't just calm down, but once I'm asleep, then something that works fast, like a vape or maybe even a tincture, that would be good. For people who have problems staying asleep, that's where the edibles come in. And if you have both, you can use edibles or tinctures or even a combination of, let's say, a vape or an edible, or you just take the edible earlier in the evening. So you might take an edible like an hour before bed. So that's generally my general recommendations for sleep. Again, everyone is a little bit different with what works best for them, but you can use vapes, tinctures, edibles, some combination, an indica strain, particularly one that has CBN. And again, at these dispensaries, they have these products. They're pretty labeled. They have like sleep gummies, and there's a couple of them, and they all have those properties.
Great. And another question about was, I thought that vaping did have possible negative effects on the respiratory system.
Good question.
Also,
Yes, good question.
Saying
So,
there's a lot of press on the problems associated with vitamin E while vaping.
good. So I'm glad you brought it. That's very knowledgeable participant. Right. So vape, the nicotine vapes are legally available at like Walgreens and some of that. And they're mostly nicotine. And I'm not a big fan of nicotine. It's not the best thing for you. It can raise your blood pressure, raise your heart rate. But the problems with even the legal nicotine vapes are some of the additives that are put in, some of the chemicals and the flavorings that have caused some respiratory problems. But the real issue is from some of these, illegal vapes or vapes made in China and stuff like that has God knows what in them. What was interesting, a couple of years ago, one of these illegal vapes had vitamin E in it. And vitamin E is good for the body if ingested, but if inhaled, the lungs don't like vitamin E. Vitamin E is very toxic if inhaled. And so you had a lot of these young people using these illegal nicotine vapes end up in the hospital in ICU. And so the difference has to do with the regulation. So what's great about medical cannabis, as opposed to using recreational cannabis medicinally, with the exception of Maryland, where the products are similar, is that you know exactly what's in it, how much THC, how much CBD, what are the terpenes, what are the strain, but you also know what's not in it. So all those things, those chemicals, those flavorings, those additives that you can find even in the legal nicotine vapes, and certainly who knows what's in the illegal ones, you don't have that in the medicinal vapes. It's basically plant oil. It's just the cannabis into a concentrated oil. And they check it for pesticides. They check it for bacteria and stuff like that. That's the benefit of the regulation. So as long as you're getting a vape from a medical cannabis dispensary, it should be safe to use. That's a really good question.
All right. Gene has a question. Do you recommend CBD for interstitial cystis?
It's okay, Steve. Interstitial cystitis. Okay. So interstitial cystitis, is a complex disease. Inflammation is a component. One of the things that's really good for inflammation is CBD. So anyone with lots of inflammation, a better example is arthritis. So anyone that's got a little bit of pain from arthritis, and arthritis is an inflammatory disorder, you could try high dose CBD. And what's good about CBD is that it will not make you sleepy or high. As I mentioned, you can get it without going to a dispensary. You can purchase it online. There are certain places you get it. Just if you do that, be very, very careful about where you get it, just to make sure that it's good, high quality CBD and you know what's in it. But it could help. Now, the problem is that a lot of patients that I've seen with interstitial cystitis, they have pain, they have a lot of other issues, and often you will need more than just the CBD. But it's a good start if that's something that you want to try. Just, let's say you have arthritis and, it's every once in a while there's a little twinge here and there, but you're not in disability pain, you're not sleeping because of it. Yeah, you could try a little bit of CBD and see if that helps. Same thing, if you've got some mild interstitial cystitis, you could try CBD by itself and see if it works. But people who have more and more the worse the medical condition, the more likely you're going to need THC.
All right. And Catherine asks, when dosing for pain, what is it that one feels when it's working correctly? Is it diminished pain? Is it being sleepy, or is it being kind of high?
Right. So generally, there's a dose response curve to use of cannabis. So what's great about cannabis as a medicine is at the lower doses, you can get pain relief, you can get anxiety relief, you can get muscle spasm relief without feeling sleepy or high. And then as you go up on the dose, while you may get more relief in those areas, you have more likelihood of being sleepy and high. So the trick is, that's why I said we start low and we go slow, is to find that sweet spot where we get the benefit of the cannabis without the side effects that we don't want. Most patients are able to achieve that. Not everyone, but most people are able to find that sweet spot.
Okay. Now, this is interesting. Someone says, how does one use medical cannabis for severe, even drug-resistant anxiety? Is sometimes trying cannabis or a holistic medicine because people are not having a response to traditional pharmaceuticals?
Absolutely. Again, the top three things that I see: sleep, anxiety, and pain. Cannabis is very, very good for all three of these things. And usually the people that I see for that have tried everything. They've tried the traditional prescriptions and it just hasn't worked. And many people are able to find relief with cannabis. So yeah, it's certainly worth a try. You know, that's why you use it.
Now, this is a good one. Ruth asks, how can we refer clients to Dr. Mintz? So is that done through your website? I'm happy.
All my information is on my website, www.drmintz.com, drmintz.com. You can call our office at 855-646-8963, and just, you know, say that you're interested in medical cannabis and you make an appointment and we'll see you.
And you're practicing in Maryland?
I'm in Rockville, so I'm at 6000 Executive Boulevard, right across from Pike and Rose, in Rockville, Maryland.
Okay, great. Let's see. Jennifer says, I saw a video online which demonstrated the effects of edible marijuana for a Parkinson's patient. The pre-video showed an older male with clear symptoms, uncontrolled muscle movements, speech impairments, tremors. The post video indicated substantial improvements in all symptoms. Have you had similar experience with Parkinson's?
Yeah, so it's unclear whether cannabis will treat the underlying disease. In other words, like, you can't necessarily take cannabis to prevent it. I'm not saying it doesn't. I'm just saying we don't know. There's not enough information to know how cannabis would affect the brain in a patient with sort of Parkinson's. Where it works really well is the tremor. So we do know there's very good evidence that it can decrease the tremor, and then it also can help other symptoms with Parkinson's. So people with Parkinson's have mood issues sometimes. They have problems getting energy sometimes. So it is very good for the symptoms of Parkinson's. Unclear whether it's affecting the underlying disease or not. But yes, I've seen patients with terrible shaking and they use cannabis and it controls it very well.
Okay. And then Renee says, can you get a hangover from marijuana?
I wouldn't call it a hangover. So again, I don't know if there's a medical definition of hangover, but my definition would be, after use of a recreational substance, you feel ill and sick. So you don't typically get that as an after effect. If you use too much of cannabis, you can feel sick, but that's a dose effect. It's not like I use it and then the next day I feel sick. Like people who use too much alcohol get an alcoholic hangover. It's not until the morning after. It's not while they're using it, unless they use so much that they throw up. So you don't really typically see that with cannabis. What you can do, depending on what type you use, you can get sort of lingering sedation. So for example, you use an edible at nighttime, which helps you fall asleep and stay asleep. But then when you get up, you still feel a little bit sleepy. So I wouldn't call that a hangover, but you can get that. And so if that happens, then it's a matter of dosing and timing and formulation. So for example, if that were to happen, you could either take the edible earlier so it doesn't last as long, or you could switch to something like a tincture, which lasts less. And so, and everyone's a little bit different too, how they metabolize cannabis. Some people are super sensitive and they need low doses and it lasts really long. Some people are not sensitive at all. They need high doses and it doesn't last that long. So I wouldn't call it a hangover, but yeah, you can, if you have edibles in particular, you can have some effects that last longer than you want, but they're all addressable. They're easily addressable.
All right. And I just glanced at our LinkedIn audience and Gwendolyn has a question there. She asks, are there any advantages to decrease the inflammation that occurs with acne?
Ooh, I am not aware of any studies or patients that I've treated whether it does that or not. THC and CBD have anti-inflammatory properties. CBD tends to be the more anti-inflammatory of the two, and that's one of its main things. So you could try some topical CBD and see if that helps with acne. Theoretically, it might. That being said, I've not treated a patient with acne with topical cannabis or CBD, and I don't have any data that shows that it works. But in theory, it could help. It's anti-inflammatory, and you can use it topically.
And then Paula is asking, did you say recreational marijuana is available at medical dispensaries? And then a follow-up on that too, is there a pricing difference between medical marijuana and recreational marijuana?
All right, so okay, let's just talk about Maryland first. So let me clear that out. So basically, Maryland first went medicinal. So all the dispensaries that you've been seeing in Maryland are all medicinal dispensaries. In the election last year, the state voted to legalize medical cannabis. And so in January of this year, legislators got together and figured out how are we going to make this happen. And so what they decided, which I think was a wise decision, was that rather than create a new and separate market, just open up the current market to non-medical patients. And so that's what they did. So all of the current dispensaries in the state of Maryland are medicinal dispensaries that are now allowing non-medicinal patients, recreational patients, to come in. So you can get similar products. The difference is that non-medical patients can't get all the products, they can't get as much, and they have to pay taxes. I believe starting in January of 2024, we will start to see recreationally only dispensaries. And how those products are regulated, I don't know if that's out yet. I haven't seen it. One of the things I like about the medical products is they're tightly regulated. What I mean by that is that the product is grown on a farm, and inspectors go to the farm and make sure they're growing it right. They're not using pesticides and doing all the right growing processes. And then they take that plant, and when they process it into gummies and tinctures and creams, that plant goes to a processing plant. And just like a pharmaceutical factory where there's regulators to ensure that there's no bad stuff that goes into the pills that you take, same thing happens with medical cannabis, that these gummies are medicinal-like in quality, and that they're not being cooked in someone's backyard like in a DC. If you buy a recreational gummy in DC, you have no idea what's in it. John cooked it up, whatever. So it's the same exact medical grade products that you have available in the state of Maryland currently. So that's what I know it's confusing. Very different in Virginia, very different in DC. But in Maryland, I'm glad. I would definitely recommend that if you're considering just purely recreational cannabis, you want to relax a little bit about a hard day's work, that I would get it at a medical dispensary from the same places, even if the recreational market opens up and it's cheaper. Now that leads to the second question, was the price difference. It really depends on the market. Right now, there's no difference in pricing, I believe, for medical patients. Medical patients may get a slight discount in addition to the taxing. I believe that's true. I believe seniors get a discount at most dispensaries as well. Veterans get a discount at many dispensaries. So there are some discounts, but price dollar for dollar, at least in Maryland, it's not different. DC, I'm pretty sure that the recreational cannabis is cheaper than the medical cannabis, but the medical cannabis is a much higher grade, and that explains it. I don't know the pricing that much for Virginia. Virginia also may be, I do not think there are recreational dispensaries in Virginia. I think Virginia is one of those possession states. Like you can grow it and own it, but you can't sell it, similar to DC.
Okay. Now this is a good one. What about anxiety? Doesn't marijuana make people paranoid? Is there anything that helps with the anxiety?
Great question. So this goes back to dose response. So it is true that very high doses of cannabis can cause anxiety, but paradoxically, very low doses of cannabis decrease anxiety. So it's all about dosing. So a lot of patients will tell me, I only tried cannabis once in college and I smoked it and I got so anxious I never wanted to try it again. Well, one of the reasons is that one of the downsides of smoking is that it's besides the negative effects that smoke has on your lungs, it's very hard to take a little dose, a small dose when you smoke it, because when you smoke it, you have to really inhale. It's hard to take a little puff of like a cigarette, whereas with the vapes, you can actually take a tiny little sip of a vape, which is different than smoking. So most people who have had that, they were just very sensitive and weren't able to take a small dose. So by starting at a very low dose and not smoking it and going very slowly up, slowly going up in the dose, most patients that I see are able to get anxiety relieving effects without it causing anxiety.
Okay. And boy, lots of great questions here. Clarine asks, would marijuana, recreational or medical, affect balance or spatial orientation, which I think would really be something of concern to an older adult that might have some balance or mobility issues?
Good question. So the answer is theoretically yes. Okay. As many prescription medications can do. I mean, if it's affecting your brain, your ability, it can do that. So, but the real question is, what is the risk to seniors? So this has only, to my knowledge, been studied in one place. It was in the state of New York. This is a couple of years ago. And they took, I want to say it's about 250 seniors who had registered for medical cannabis and were using it. And they tracked them over time for like a year and looked for falls and didn't see any increase in fall risk for seniors that were using medical cannabis. It's not the biggest or most scientific study, but it suggests that it can be used safely. So again, it's about dose and response and doing it carefully. So yes, a senior who says, okay, I think this would be fun, and goes to a dispensary as a recreational patient and gets a 25 milligram gummy and takes it for the first time, having never tried cannabis before, and they get really disoriented and high, yeah, they can fall. So the answer is yes, it can do that. But on the same token, if it's done correctly under supervision, ideally of a doctor, then I think you can do that. And that's true of any medicine that a senior takes. I would argue that cannabis for sleep is safer than Ambien for sleep, because Ambien, you don't even realize that you have this amnestic property. People are like sleepwalking on Ambien. And you can't, it only comes in certain doses. It only comes in 5s and 10s, and you can split it in half. You can't dose it drop by drop. That's what I love about tinctures. So I could start, with drop by drop, and seniors might not feel anything until they hit drop number 6, but at least I know what's going to affect them. So yes, you have to keep that in mind, especially with seniors. But so it can do it, but it also can be done safely.
All right. And Paula asks, how does cannabis affect your heart rate?
THC can raise it a little bit.
Okay.
Some people are more sensitive to it. That being said, it doesn't, to my knowledge, increase risk for like heart attacks or strokes or anything like that. So it can raise the heart rate a little bit, but it shouldn't affect maybe the blood pressure a tiny bit. But like if you have heart disease, like that's not a reason to not use it. It's a reason to use it maybe a little bit more carefully than, again, going to the dispensary and taking a 25 milligram gummy for the first time. But if you're using medicinally, again, starting low, going slow under the supervision of a doctor, I think even heart patients should be able to easily take it. And I've given it to lots of patients who are on blood pressure medicines and at risk for stroke and things like that.
Okay. And Barbara's wondering how it interacts with blood thinners like Eliquis.
Good question. Okay. So basically the way our drugs are metabolized in our body or through the liver. And there are certain enzymes in the liver that help with that. And many medications, when you hear a drug interacts with medications, it means it either speeds up or slows down those enzymes. So that's why, for example, you can't take your Lipitor with your grapefruit juice, because grapefruit juice, I can't remember which one, increases the metabolism, so the Lipitor is not going to work. So both THC and CBD can affect some of those enzymes. However, the effect generally is pretty minimal. So you really don't need to adjust the dose for most medications. And so while there are some interactions, I've not really adjusted any doses for any patients in a meaningful way. Now, blood thinners are a different story, especially Coumadin. So Coumadin is so sensitive that you really have to be careful, and you have to monitor the Coumadin level. The newer medicines, like I forgot which one she said, Xarelto or Eliquis or whatever, they are not as variable. So you should be able to take it with that. But again, anytime you're on medications and using other things, you should talk to your doctor. But it should be safe with use with the newer blood thinners.
All right. Now, Mary's got a great question. Recommendations on where to find a reputable CBD or medical marijuana seller. And, I think one of the differences as I'm listening to you talk is that when we go to the pharmacist with our prescription, it's very defined. I'm going to get this prescription. It seems to me like there might be a little bit of wiggle room when you walk in to a dispensary on what you may walk out with.
Right. So I'm going to break it down to sort of 3 answers. One is reputable dispensary. 2 is reputable recommendation, and 3rd is reputable CBD. So in Maryland, in general, a medical dispensary should be reputable because they're highly regulated by the state. Now, there are other things that you can look at as far as which one do I go to, versus, proximity and selection. Do they have the right products for you, et cetera? So there are some pros and cons. There are some dispensaries I favor more than others based on their, staffing and location and selection. But from a quality standpoint, they're all regulated by the state, so they should be safe. And if you get a certain product, that product, what's in it, and et cetera. So that's one thing. As far as what to take, though, that's a different story. Like you mentioned, Steve, when I certify a patient, all I'm doing is giving them the paperwork that allows them to go to the dispensary and get products. Now, I will print out for my patients specific recommendations. I'll say, go to this dispensary, get this product, use this product this way, use this product the other, and I write that down. But those are just instructions for the patient. It's not like a prescription. Like the patient can say, Dr. Mintz doesn't, or the guy at the dispensary can say, oh, Dr. Mintz doesn't know what he's talking about. Here's what I recommend instead. So you can totally do that because it's not like a prescription. So again, as far as guidance as to what to use, again, you can come see me, or you can come see a doctor that, sort of has done this multiple times and will give you those instructions and not see a piece of paper. That's to me is the best option. And the folks in the dispensary some of them have some knowledge. So if you are relying on them, make sure you see a manager or a supervisor or someone who has been there for a while, and not someone who just started a week ago because they didn't like their job at Starbucks. Now, as far as the CBD, it's tricky. So you can get CBD at a medical cannabis dispensary, but if it's a marijuana-based CBD, it's usually way more expensive than the hemp-based CBD. So most hemp-based CBDs are purchased not in a dispensary, but they're purchased either in retail or online. And there are some CBD shops that are out there that sell retail products. Mom's Organic Market, I believe, sells some CBD. There are some places, but if that CBD, even if it's Mom's, it's not regulated. So you have to know the most important thing is that what you get, what it says in the bottle is actually in the bottle. And so the way you do that is you need to make sure it comes from, because there's no like USPC symbol for cannabis. That's what the vitamins have. There are certain certified vitamins. So if you go to a CVS and you get a vitamin and it says it's USPC certified, it means that if it says 500 milligrams of vitamin C, it's 500 milligrams of vitamin C. And if it's not on the label, it's not in there. And so we don't have the same thing for CBD. So the way you can do that is to get them from companies that have independent third-party verification, meaning that, and it will say this on the website, and usually there's a QR code or a link on the website where you can see the report. So it's a third party, not owned by the CBD company, that does an independent analysis of their CBD and says that this is how many milligrams of CBD, this is how much THC, there's no pesticides, there's no chemicals, there's no fungi, et cetera. So you need to make sure that the product that you're getting has third-party verification, independent third-party verification.
All right. And I see by the clock we're getting close to the top of the hour. So let me just do a couple more and then we'll wrap things up. But Gene says, what are the contraindictions of cannabis? Contraindications.
I think he means contraindications. And so
contraindications. Okay. Yep. I got it. I mispronounced it.
Right. So really there aren't too many contraindications. I don't think there's anyone, who I wouldn't prescribe cannabis for. Certainly if you have a major problem with substance abuse, that would be, and I suspected that you might, abuse cannabis, even though I said it's low in addiction, it doesn't mean it's not addictive. So that would be one thing. Someone who's, on cocaine and on heroin and, alcoholic, they probably wouldn't be the best person for cannabis. The people who, other than that, there's really no, to my knowledge, specific contraindication where you absolutely can't use it. There are medical conditions and medications, being a senior as well, where you're going to, or even being young, where you're going to be using it very carefully, but that wouldn't be a contraindication. So there's not anyone who I said, absolutely, you can never use cannabis because it's too dangerous. There's no real contraindications except for substance abuse.
Okay. And then let's make let's make it on the last one here is Susan asks, there seems to be a lot of trial and error in figuring out the dosage for the edibles, the vapes, or the tinctures. Does consumption of food or obviously alcohol can impact everything? Does that play into how you're gonna react to this?
Alcohol and other substances, certainly. So, especially so for people, the one question about the person taking all these anxiety medicines. So if you're taking an anxiety medicine like Xanax, for example, what can make you sleepy, while it's not a contraindication to take cannabis, cannabis can make you sleepy too. So both those things together can have effects. So there are medications that can, increase the effects of cannabis. So you have to be careful about that. Food should only affect edibles, and it probably doesn't affect it that much. So food, on an empty stomach, not on an empty stomach, it should only matter for edibles, and it doesn't really matter that much.
I love it. All right, I think we did it. We blasted through dozens of questions and a really great overview. Kathleen, that was some amazing questions to get things started that you had. I'm delighted to be partnering with SmithLife Homecare on this discussion, and hopefully we can continue doing these.
Thank you, Steve. We really appreciate it. Hopefully people will also consider calling SmithLife Homecare while they're trying to age safely in place at home at 301-816-5020. And Dr. Mintz's contact information, ours, everyone's, is in the chat box. So if you need more information, please feel free to go there. And thank you for the opportunity. Very interesting. Very interesting. I really appreciate the increased knowledge, and especially regarding Parkinson's. I find that fascinating. Thank you, Dr. Mintz.
My pleasure. Thanks for having me. Great to see you all again.
This was great, y'all. And if I don't see y'all before the holidays, have a great holiday. And Kathleen, congrats on your graduation. And Dr. Mintz, as always, you're just such a wealth of knowledge, and it's great to see you supporting the community like you do.
Thank you.
Thank you all very much.